I'm Ysela Llort. I'm the chair of the planning committee for this workshop, and it's my distinct pleasure to welcome all of you here today, this morning, both the people in this room as well as our virtual audience, because this is being webcast. So let's keep that in the back of our minds as we speak through this, that there are people who are seeing it, but they're not people who are here, but they're also participants. I want to thank just a ton of people for this wonderful opportunity. Of course, our Federal Transit Administration for sponsoring this, and the National Academy of Science for taking on the challenges, both the Division of Medicine and Health, as well as the Transportation Research Board. You know, this is really a wedding of these two divisions. But unlike weddings and marriages, I don't want people to be sitting on, here's the transportation side of the room and here's the health side of the room. So please, even if you're comfortable now, let's switch around so that we get to know each other, because it's going to require each and every one of us to solve and to come up with better models of improving transportation to healthcare delivery so that we can do what's really needed, which is improve wellness and livability. Before I became a transportation person, I was an anthropologist, which, by the way, I would say everybody needs to be an anthropologist before they're an engineer. It helps balance, Neil. But I spend a lot of time learning about Mesoamerican culture. It was my thing. And one of the things that you learn pretty quick was that in all settlements, transportation helps define the quality of that settlement, human settlement. It helps deliver security, and it helps deliver quality of life, even though they didn't used to call it that. For example, in the Mesoamerican ancient cities, they knew right away that they needed to build these roads, these wonderful roads, Carolyn, in order to be able to connect their strategically placed settlements to the sea, because it was only by connecting to the sea that they could bring in fresh fish. And fish was the determinant of wellness and health in those days. Now, the challenges are quite different now, right? It's not about bringing fish to the community, but it's certainly about the basic tenet still the same, which is how do you improve wellness and quality of life for people? And we've been doing this for many, 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 many centuries, but it becomes more complex every time, because now we have a lot more rules, we have a lot more people, but we have some help. We have money at the table, we have better metrics, we have better information systems. So I think that the stage is set for how to improve collaborations and how to improve transportation delivery so that we can indeed do that which is the biggest challenge, improved wellness of our citizens and our visitors to our community. Now, having said that, we're not going to arrive until not only do we have the good collaboration models, but frankly, until we can measure the outcome of what we're doing. I have found that nobody is willing to throw money at the table until you can measure what it's doing in benefit of the ultimate goal. And I think we're a ways away from being able to say, if you put in one more widget of transportation, what are you going to be doing in terms of increasing livability, increasing quality of life, and reducing health costs? But we're making baby steps. This is the first joint conversation, not the last conversation. Okay, so having said that, all of you know that we have a loaded program, a very loaded program. So we're gonna, like transit systems, we're gonna run this baby on time. All right, and in order to set the stage for us this morning, we have the two grooms of these fine organizations. We have Neil Pedersen and we have Clyde Behney, and they will come up and they will share comments with us on the start of the conversation. Thank you. Neil.
Thank you, Ysela, and welcome everyone, both those of you who are here in person and those of you who are online. And welcome to the headquarters of the National Academy of Sciences, Engineering, and Medicine. We are certainly glad to have you visiting our facility, and I hope you get the opportunity to go around and visit the building itself. It's quite an historic building and some wonderful artwork here as well. So first, let me thank each of you for agreeing to participate today. I think each of you brings a unique perspective that you can be contributing to this very important conversation that we are about to undertake. I want to compliment the Planning Committee on what really looks like is going to be a great program. Very impressed with the speakers and discussants who will be involved in the program. And I think it will really help enrich the discussion that we are going to have over the next day and a half as well. So I want to pick up a little bit on a couple of the points that Ysela was making. Although I was not an anthropologist by training, I did take cultural anthropology courses in school. And I do understand from an anthropologist's perspective why access to health care is so important. In fact, I very distinctly remember a couple of the readings that I had in my cultural anthropology course in which this issue came up in 1972, I guess it was, so over 40 years ago. So it's not a new issue, obviously, and it is an issue that we've had fits and starts with. In fact, Clyde and I were talking before. I think the last time that we really had a major initiative with our two divisions working together was over 10 years ago now. So it is time for us to be looking at this issue. I want to give you just very briefly my perspective on transportation, and it's somewhat of a radical perspective within transportation, but I think gaining more and more credence. Transportation does not exist to serve itself. Transportation really exists so that we can be trying to achieve other more important things in life and in society. Things like improving the economy, things like improving quality of life. And I think more and more we're starting to recognize that transportation has a role in terms of supporting public health as well. In fact, when we discussed it with our executive committee a year ago at this time, last June, and we talked about the list that I'm just about to go through, we were also having a discussion with them about what were the big future-focused strategic issues that we should be concentrating on at TRB. And after we got through this discussion, they said, well, clearly transportation and public health has to be one of those issues. So we have identified this together with transformational technologies and resilience as one of the big strategic issues that we want TRB to be focused on. And we went through and had a discussion, and I want to give credit to Victor Zhao, the president of the National Academy of Medicine, who used this slide in talking about the intersection of public health and transportation when he spoke before our executive committee in a policy session that they had last January. And if you start to think about it, you can really sort it into transportation's effects on health and disease, as well as transportation as an enabler for health improvement. The number one cause of death in the US for the demographics between age 4 and 34 is traffic crashes. If we start to think about traffic crashes as a public health issue, it's a totally different perspective on the issue of traffic safety. And I will tell you from my experience as Governor's Highway Safety Representative in Maryland, it changes the entire conversation with elected officials as well. And they start to see it from a different perspective. The spread of disease through the transportation system, whether it's contagious diseases like Ebola or the Zika virus, or whether those of you who rode on the metro system this morning and had someone sneeze next to you, we need to be thinking about that. Transportation's environmental footprint and the adverse health effects, particularly from air and noise pollution. And recent studies have just shown that noise pollution for children growing up adjacent to freeways is a much bigger concern than we thought it was, as an example. Promoting healthy and safe transportation options and understanding the importance of being able to provide for both pedestrian movements and bicycle movements so that those more active transportation modes can help from a public health perspective. Obviously, we are here to talk today about transportation's role in providing access to healthcare, and I'll talk just a little bit more about that in a second. And then transportation as a means to enhance mobility for the elderly and disabled. The last meeting of the National Academy of Medicine particularly focused on issues associated with aging. And being able to provide for transportation for the elderly ends up being critical, both from a health care perspective and from a quality of life perspective that relates to their health care as well. So you can see there's a whole range of issues at the intersection between transportation and health care. And my plea to you is that we keep this broader context in mind as we have our discussions over the next day and a half. That we remember that the outcome that we are really trying to achieve here is improved health. And it's very tempting. I've been involved in many conferences and workshops of this type to be getting into the weeds, to be caught up in the details of issues that you're talking about. But please, over the course of the next day and a half, let's keep in mind that what we're really trying to achieve is that outcome of improved public health. Now, the big challenge is, how do we know when we've actually achieved that outcome? And we have recognized, and much to FDA's credit, they have recognized that we really do not have good measures in place that enable us to understand whether the investments that we are making in trying to improve access to healthcare facilities really are making a difference in the ultimate outcome that we're trying to achieve in terms of improved health. So that's really what we need to be focusing our discussion on over the next day and a half. How do we know whether those investments really have made a difference, and how do we know whether we are putting our resources in the right places in terms of the ultimate outcome of public health? And I look forward to the results of your discussion. I think they're going to really help inform the discussion as we in the Health and Medicine Division figure out how we move forward together in terms of this ultimate outcome of improved health that we're trying to achieve. It's now my pleasure to introduce my colleague, Clyde Behney, who is the Executive Director of the newly formed Health and Medicine Division, and he's going to give you some more background in terms of the reorganization and the formation of that division. Clyde?
Well, first let me express my disappointment. I thought this was a meeting to fix the metro system in DC, but it's not, evidently. The previous speakers have really covered most of what needs to be said, but let me add my welcome to all of you, and whether you're here or watching remotely, and add my thank you to the Planning Committee, and thank you to the sponsoring organization, Federal Transit Administration, and the speakers who are lined up, which is a very impressive group. The thing that impressed me was two things. One, the fact that the first big meeting like this is not going to recommendations for how we'll change policy, et cetera, like some groups love to do immediately, but first thinking about data, first thinking about, as Neil was saying, how do we measure what we're doing? What are the valuable ways to measure value? That's not something that everybody automatically does. They tend to leap over that, and it's harmful when they do. So it was very nice to see that that's one of the organizing focuses of the meeting. The second thing is that the range is not limited. This is a very broad range of topics to be covered. And I think that's terrific. I will say the slides and the orientation are all how transportation can help improve health outcomes. But I would urge you not to forget that healthcare, health systems, the learning health system, what we learn about trauma care in military situations can actually improve transportation outcomes too. So, you know, there's a little bit that it could go both ways. Neil mentioned the reorganization. It's a little bit of inside baseball, but the National Academies recently did a major reorganization. And the Institute of Medicine, for those of you who are familiar with that historical organization, the program side of it, the research side of it, was moved into a division, Health and Medicine division, alongside other divisions like the Transportation Research Board, Engineering and Physical Sciences, et cetera, in order to do things like this, in order to be a more parallel, a more integrated organization that could take advantage of the really quite impressive set of disciplines that exist both in the membership, the volunteers, the staff. And this was a way of making the organization a little tighter, a little more coherent, and a little more integrated. And activities such as this represent such a nice expression of the goal of that reorganization, bringing, excuse me, bringing different viewpoints, different expertise, different history of looking at topics, and a different way to approach activities sometimes. Bringing those together because problems are like that. Problems are not single discipline problems, and the solutions won't be either. So again, a little inside baseball, but I thank you all for taking part in what is really one of the first very nice expressions of fulfilling the goal of that reorganization. So again, I think it looks like a fantastic day. I hope you enjoy it. I hope you become excited about it, and I look forward to seeing the results. So thank you.
Thank you, Neil and Clyde. And thank you for the remarks and reminding us that even when you started at the beginning, you had to keep the end in mind, Neil. So, and we will do that. I do want to thank the planning committee for this workshop. These folks, y'all were fabulous, absolutely fabulous. And certainly the staff as well. Alina and Steve, wherever you are out here, you guys are power horses. You're amazing people committed to improving the lot of the people in this country and in the world. Let me take you really quickly to the next day and a half before we get started on our program. We have a lot to cover. Today is going to focus on looking at, even though we're at the beginning, there's a lot of work that's already being done in this area. There's a lot of collaboration that's led to pretty good models of integrating the two areas of transportation and healthcare. So we're going to be talking about these with the experts, and we're going to be having notable examples of how this is happening across the nation, both for urban areas as well as rural areas. And there is a difference between dealing with, there's some similarities, but there's some market differences and market challenges in dealing with the two. Then we're going to have the start of the discussion on data, information, and metrics. What data do we now have? What data do we need in order to form this complex collaboration and outcomes? What information, where could it come from? We're not going to, Clyde, we're not going to have recommendations, but we will be having observations because that's partly why we're here. We're going to have observation about the gaps, about the challenges, and and because the people in this area are amazing people who are very experienced and who are very knowledgeable, we will be having very good observations about what the next steps could be. And if you are tweeting, folks, please use hashtag Transit Health as noted in the program. This is for the virtual folks, we will be taking some of your comments as time allows, but if not, please send in your comments and we will be taking those into consideration as we put the program notes together. We have very extensive bios of all the participants, all the amazing participants and speaker, which I thank ahead of time for all your hard work. So we're not going to be going through a lot of bio talks in here because we really need to get on with the business. But there are a couple of people and a couple of exceptions, and I'm going to make one of the exceptions right now. The next part is really setting the FTA supported efforts, which is so important. And again, I want to thank you for putting the money together for this workshop.